4, 3, 2, 1. Hi everyone, welcome to my brand new relaunch of Addictions, Abuses, and Recovery. My name is Sherry Irvin and I will be your host today. With me I have special guest Vickie. She is a psychiatric nurse practitioner, emergency department consultation liaison. Vickie works at one of the major hospitals in Rochester, Minnesota, and she sees the front lines of what addiction and mental illness can do to the patient upon entry into the hospital system. We're going to sit down today and we're going to have a real talk about what goes on in the emergency department, what goes on with the families as well as the addict that is going through their mental crisis, adding on to addiction. And we're going to sit down and see what, what a typical day is like for her. So it is my pleasure to introduce to you my really good friend, Vickie. Hi, Vickie. So happy to have you here today.
Yeah, I'm so happy to be here. This is wonderful.
Yes. So getting kind of down to, we all know that addiction and mental health, mental illness, they go hand in hand. They're co-occurring.
Yeah.
And, it's especially the numbers are rising horrifically. And now you add on COVID-19. And, the numbers are even skyrocketing even more. Right. So if you could kind of share with us, what it is that you exactly do and what a typical day in the trenches of the emergency department that you go through.
Okay, sure. So yeah, I am a psychiatric nurse practitioner. I am actually a consult service for the emergency department, and when I'm on the consult team, we are consulted from the medical teams in in our hospitals. When a person is brought into the emergency department, they are initially seen by emergency medicine, and then if they feel that they need psychiatry assistance and management of the patient, then they'll consult us. So what I've been seeing, and it's been going on for a while, of course, but it has actually gotten worse with COVID-19, is seeing a lot of a huge increase in alcohol use and abuse. A lot of people coming in, with alcohol intoxication, and also a lot of people with methamphetamine use is a huge problem. And then also, I think marijuana has gotten a lot stronger, and there's a lot of different, I don't know even how to explain it, different ways of using it, and from wax to different kinds of levels of THC and things, and I'm seeing a lot of people that are just smoking weed and are getting psychotic, and they're and also with methamphetamine, these people are up for days and days at a time. They're not taking care of themselves, and they eventually become psychotic as well, sometimes very agitated. So they're brought into the emergency department, usually a family member, or they're acting bizarrely out in public. Somehow law enforcement is called, and then they usually bring them into the emergency department. Unfortunately, I can say this, is that I don't feel that we have a, and I think they do their best, but we don't have a good detox program in Rochester. And I think that really needs to be addressed, because people need to be managed with withdrawal, and then also have the option of going on with treatment and so forth from that place. They're brought into the the current detox facility that we have now is very limited in what they can manage. They can only give oral medications, so they can't take people that are agitated or are in more severe forms of withdrawal, even from alcohol, that require, that are, having, at risk of seizure, or having DTs. They can't manage a very psychotic patient coming off of meth. They don't do any kind of medicated assistance in helping someone withdraw from opiates either. So I think, that's a huge problem in our community, is that we don't have a detox center that's able to really manage detox. So that's why a lot of these patients end up in the emergency department and then admitted to medicine services, is because they need to be managed properly. The other, I mean, the one thing I will say that's been really great over the last few years has been Recovery is Happening started a peer recovery specialist. So that's been really helpful to us. Because before I felt like I had nowhere to turn to even give these people help. So a lot of times, you know, a patient will sleep it off, you know, they come down off the meth, they, you know, they rest a few days, and I want to give them resources because I'm not going to keep them anymore in the ER. And they don't want to come into the hospital, they're not, you know, holdable or whatnot. So trying to get them connected into the community so that if they do want to get help, and even if it's not right at that moment, they might a couple weeks from now, a month from now, whatever, that they have some resources, they know where to turn. So having the peer recovery specialist has given us that tool. And that's where somebody comes in who's in recovery themselves. They've gone through some training and so forth. But they come into the ER and they meet with these people and talk to them.
I have done that myself. In fact, I have taken the peer recovery specialist course from Recovery is Happening. And so often, you know, you have to, especially in the position that you're in, you know, you kind of have to catch them when you can. And the nice thing about, you know, Recovery is Happening and the peer recovery support person is that there are so many different pathways to lead them on. Not everybody is going to do the spiritual 12-step. Not everybody's going to do NA. Not everybody's, you know, some people prefer the Wellbriety, the Native American way. Some people prefer holistic. Some people prefer the church-based, you know. So this way, the choice is being offered to them. And, you know, so often if you don't get them kind of in that, you know, kind of like what I refer to like the paramedics, almost that golden hour, you know, you've lost them because, you know, chances are if they're older, they're gonna sign themselves out under, you know, against doctor's advice or whatnot, you know. So it's so nice that I know Recovery is Happening they have a window of time to get there once that pager is beeped. And I think that's just wonderful because you're right, they're kind of floating out there, and then, you know, they're gonna go back out and do that behavior again. They're gonna do what's familiar,
right? Exactly.
And you know, and that's really tragic. I know for myself, back a little bit of background about myself is that I used to be an EMT, and when I was doing my clinicals, one of the calls that I got called to was bringing somebody out of their overdose. And I got to tell you, you know, talk about seeing the worst of the worst. I mean, you know, they are literally at their worst. And this individual was hell-bent on dying. And, you know, because there's implied consent, because, you know, they're in no shape to make that decision for themselves, we had to bring them back. So Narcan was administered, and I got to administer that. And this person was pissed. I mean, they were pissed. I got them out of their high. You know, I got called every name in the book, you know, but I mean, you know, and you see that, you know, especially with the mental health. You add mental health on top of active use. What a chaos and what mess.
And I think even with COVID, now that you mentioned that, is, you know, that really made it difficult for people to see their providers, to, you know, and if they were seeing them, it was over a video. It wasn't the same. They weren't getting the same support. A lot of treatment facilities, you know, weren't taking new patients for a period of time, and their outpatient stuff even was over, you know, the Zoom things. So I think that people were really falling through the cracks also, even more so than before, even though, because before they were falling through the cracks anyway, but then COVID came and it just all fell apart. So yeah, that's been a big problem. And then I'm just the loneliness, you know, that COVID has, you know, has caused an impact on a lot of people. And, you know, some of us don't realize that, you know, how isolated people can be. You know, those of us who have jobs still and families and that, you know, communicate and so forth, you know, we don't realize how, and we've been isolated, and then you think about people who are isolated anyway, and now they're just totally cut off from everyone. So, you know, I've seen a great deal of relapse on alcohol, on drugs over this last year. It's been significant.
Well, and I know too that, even the suicide rate is going up. And, and that's heartbreaking, especially in our younger generation. And the kicker is that, yes, me and you are deemed essential employees. We can go to our jobs. But a lot of these younger kids, the dynamics at home are not good with the family. So many of them are homeless. So not only can they not get to a meeting, they don't have access to a Zoom room because more than likely they're homeless.
Right.
And, unfortunately, prohibition didn't work. The liquor store is still deemed essential. And I have to tell you, a part of me, thank God it is, because if it wasn't, things would be a lot worse than what they already are. And they're pretty freaking bad right now. And, so I'm very fearful, and I'm seeing more and more. I'm seeing more and more of our younger kids. This has been a horrible couple of years. There's the even the schooling system. They can't go to school normally. They're expected to learn from home. Right. At least when you were going to school, there was structure there.
Right.
And you were held accountable to go to your classes. And now, they're expected to go home, not have that guidance. The teachers are overwhelmed. They can't, you've got parents that are single parents. It's hard enough with two parents.
Right.
Both parents have to work. A lot of people have lost their jobs because of this, and they're taking work where they can get it. And what do you do? Right. And so I really see where the younger adult is getting lost in the cracks. Yeah, I'm also seeing, and I don't know if you've seen this too, but I'm also seeing a lot of mothers, they're expected to be the nurturers. They're expected to be the ones to take care of the kids or whatever. And the drinking is ramped up on them. That old fashioned saying, mother's little helper, mommy's go juice.
All of a sudden they're drinking a bottle of wine a night or two. So yeah, that's very true. Very true. It's a lot of stress on people, and even I think I hear all the time too of I've had people that have come in with mental health issues that are just and women in particular that are just overwhelmed with everything that they have to do, and the kids being there and all day and trying to just make everything work and trying to help them with school and get their own stuff done, and they're trying to work from home, but then they're trying to get they have younger kids. I think that's really challenging, is to have the younger kids there all day.
Oh yeah, I
help them through their classes and things like that. So
I cannot imagine. I can't imagine trying to deal with schooling. I know I had issues with my own son. With him trying to learn. And not only that too, they've lost out on so much. They lost out on the opportunity to go to the prom. They lost out on the opportunity for, the senior graduation. They lost out on the opportunity for the senior party. And even though, let's face it, even though we're told that we're supposed to social distance, you try telling a bunch of teenagers to social distance. They're going to get together. They're going to go to a house party. They're going to do what they need to do to get through their moment, because I know firsthand, and you probably do too with having a younger child. They're a little depressed.
Right.
So yeah, their friends are going to be like, hey, I got some liquor. Let's go.
Right.
Yeah,
exactly.
Are you seeing a higher percentage of younger people, or are you seeing a more higher percentage of maybe the older generation? Because I also know that for a fact too, because they're so isolated, I'm seeing a lot of polypharmacy, even with the older.
Right. Yeah, I think it's actually affecting both. The older and the younger. I'm seeing a lot more homelessness with the younger generation at this point. Kids in their, and I call them kids in their 20s. That I really attribute more to the methamphetamine abuse. And we don't have any, And speaking, we talked about homelessness also, is that we don't have any type of shelter system here in Olmsted County. And I think that really, we have places here that, are open in the winter, when it's very cold and so forth. And I've never been there, but I've heard rumors that there's a lot of drugs being used in these places. So we don't have any kind of, shelter. We don't have a real homeless shelter here in Rochester that has supportive services for people to get the help that they need, like mental health, addiction, even like, job, helping them like some kind of like job coaching, or, helping them look for work and get on their feet. We don't have anything like that. And I know in other bigger cities, they do have systems like that, people can actually go to these places and start rebuilding their life.
Yes.
Whereas here, all we have is one place where, they can stay for 2 weeks and then they can't come back for 2 months. That's not really helpful. And then we have the warming centers that are only open for so many months during the year, and there's no services set up there.
Yeah, especially too, our temperatures have just been frigid, and the warming houses, you're right. The places like Salvation Army, the soup kitchens, the Dorothy Day House, you can only stay there for so long.
Right.
And, these kids are out back underneath the bridge. And we all know where they're at. Yep. All the little tent cities are going to start, they crop up. And it's just, it breaks my heart.
Right.
It's tragic, because you're right. To me, they're babies. These 20-year-olds they're babies,
right.
And then you have babies having babies.
Right. And I feel like Olmsted County, or Rochester in particular, it just really kind of wants to sweep the homeless problem under that bridge and not deal with it. And because we haven't dealt with it. And there's a tremendous amount of homeless people, in Olmsted County. I worked on a project when I was in graduate school, opening a health center over at Bethel, and it was for and it's focused on people that are homeless, and we would be connected with the food line there, that they do the community foods that they would hand out a few nights a week. But that kind of slowed down because of COVID also. So all of these other little services that people had have also disappeared. People can't get food that they need, and like the health place that we had going for a while, that kind of died down as well because of COVID. So
and have you noticed too, because we're in COVID, and I truly feel that for the most part, Rochester tries to be a giving community. We try to give back, but unfortunately, because so many people have lost their jobs due to a lot of the mom and pop shops closing, a lot of some of the major other shopping centers closing, there's not money to even give back into those programs. So, the programs aren't out there to even help, the homeless. And then you add on that co-occurring mental illness part of it.
Right.
So, the bipolar running unmanaged, a lot of these kids have ADA, they can't hardly focus, much less,
right.
And I mean, and it does. I mean, and it's so hard because what's frustrating is this is destination mail.
Right.
I mean, we're one of the prestigious places in the world for your medical care.
Right.
But now we're trying to figure out, now we have to figure out how how we can help out more.
Right.
Yeah,
and that's interesting. That's one of the things that I deal with a lot too, is the families. Their child, whether adult child, usually in my cases, is back in the ER, psychotic. They have restraining orders out against them. I mean, all sorts of things, because it's gotten so bad, and they just want me to put them somewhere. That's.
And guess what? If there's not a bed available, what
right.
do you do?
And then we really have decreased the amount of chemical dependency commitments that we do. It's been, evidence has shown that forcing people into treatment doesn't work. And I think probation and some of the court stuff has kind of changed as well, and taking a look at that there's a much higher relapse rate if people are forced into treatment, especially if it's just a short-term treatment. So we were talking about that earlier, of the longer terms. 30 days isn't going to change someone's life. So, and to force them into a 30-day treatment and then all of a sudden they're set free, I mean, really, what has really changed?
Well, I know for myself, and I'm very honest about my history. That's why I started this podcast, is that I am a woman living in long-term recovery myself. And I know that when I did my 30-day stint, and I did my treatment at Mayo Clinic in the General's building, 30 days wasn't enough. I mean, I could barely do some of the basic things. And, and don't get me wrong, the General's was great for detoxing. It was great to, you were kind of given some direction, but you were told when to eat. When you had to go to group, whatnot. My real work didn't start until I got into the walls of AA. And that was my spiritual program. So I agree. I don't think 30 days even touches the tip of the problem, and especially if you've got a lot of years of active use under you.
Right. Exactly.
Seriously.
That's the truth. That's true.
Yeah. There is no, that it is just, it's not enough. And unfortunately, you're right, to try and place people, and especially, like I said earlier, addiction and mental illness co-occurring. That's not something that's going to get resolved in 30 days. The mental illness, more than likely, has been lifelong.
Right.
But it's never been managed.
But the one good thing I will say is that I know that, our county and the state, and they do have, and they are willing to pay for treatment. So, I mean, a person, if somebody wants to get treatment, they can contact the county and do a Rule 25, and they can go to treatment. And they don't have to just do 30 days. They can do a longer term program, and there's a lot of things available to people. So we are lucky in that sense that people can get the help if they want it.
Oh, that's
wonderful. It's just really that, they have to want it. And so that, I deal with that a lot with the families of, wanting me to commit somebody and or wanting us to do more and hold them there forever. And, and I understand that. I mean, I personally have, I myself am, I had addiction years ago, been clean for a long time. But more recently, I have a child who's really struggling. So I'm I'm like learning how the families feel when they're looking at me, or looking at other, professionals out in the community. And just, you just get so frustrated because you're like, why isn't anyone doing anything?
Oh, yeah.
And so it's, my son has been involved a lot in the court system, and just, on probation, and no one is pushing him to do anything. And it's just like, basically, if he's doing a little, if he's doing a little and he's not, this, and even if he's getting in trouble on top of it. Yeah.
And I think what would be so hard for you too is not only, okay, so you are a psychiatric nurse practitioner, but now you have to look at it from the aspect of being a mom.
Right.
And watching your child struggle. I worry about my sons. I'm not stupid. I also know they dabble. And here I am, a woman in long-term recovery, and I'm trying to tell my children that, what are you doing? And unfortunately, you and I both know, because we have both dealt with these issues, is that that's their journey to take.
Yes.
And I always tell my boys,
say that to myself every day.
Every day. And I tell my boys, you know what? In the standard that I set for myself, you know what? I didn't choose to be an alcoholic. I did choose to take that first drink.
Mm-hmm.
However, there are consequences for your behavior, and you will own them.
Mm-hmm.
I can't, you know, you're 21, you're 18. Mom can't come in and save you. But it's very hard as a mom to watch your child go through this when you deal with, you know, when you deal with these things. And it's so, and it is, it's so hard. It's so hard as a mom. I feel pretty.
It's something I wish I would never wish it on anyone, to see your child go through something like this. You just every night you worry, every time they leave the house you worry, every time they walk in the house you worry. I mean, you just worry, constantly worry that they're gonna overdose, something's gonna happen, and they're just not gonna. You're not gonna be there. No one's gonna be there, and no one's gonna be able to help them, and they're gonna die. So, and it's just and I mean, people can say, oh well, we all worry about our kids. This is so different, and it's just and to watch their lives literally be taken from them by this addiction is just so saddening, and so and not to be able to help them, and
absolutely. So, and in fact, you can hear the background noise because my kids are both taking off to go hang out with their buddies, and and I worry about that. I mean, inwardly I know that they're adults. I know that I know that it is their path, but I always worry. I'll be honest, I always cringe when they say they're going with their friends. Because I know. And the only thing that I am very proud of is the fact that they are responsible enough that they will not drive, they will stay put. Just because they've watched their mom. So, and not that I'm proud of that, but in a way I am, because now they'll know that, not only is it expensive, to get your license reinstated and to lose your license, and not to mention the fact that you run the risk of killing somebody, hurting yourself, so I'm very grateful that, and they always kind of tease me, Mom, we can always get an Uber or a Lyft. Thank God. But but I do. I as that mom, I just cringe. So tell me too. This is another thing, and I've dealt with this even when I was doing my clinicals, is the response of the families. I know for a fact that is supportive as they want to be. They've heard all the bullshit. They've heard the, I'm never gonna do this again. I'm so sorry, Mom. Or the spouse is talking to the other spouse, I'll never do this again. They hear the excuses over and over again. And it's almost, they're kind of just, oh my God, just take them.
Put them somewhere.
Put
they need
them
to be
somewhere.
Committed. They need to go to treatment. So, and so, I mean, I think, my experiences in life have helped me become a better provider, and with the experiences that I'm going through with my own family, it has changed the way I think I relate to the families better, and I understand what they're going through.
You definitely have to have that empathy piece. I mean, and I think that's the one thing that, people don't understand. None of us wakes up in the morning and says, you know what, I think I'm going to be an alcoholic. I think I'm going to be a drug addict, because we all know that the studies are out there. And one of my favorite people of all is Dr. Gabor Mate. And, that it stems from trauma. And, we're hiding from something. We're running from something. We're ashamed of it. And you know what? The easiest thing to do is to get caught in the numbness of it. I know that's why I did. I wanted to be numb. I didn't wake up to intentionally hurt my family. But unfortunately, I did. I owned that first drink. and I liked how it made me feel. And then I realized, oh, I can really lose myself in this. And then you're caught. And then you have all the intentions of the world to stop. But the craving's there because now the pathways are in sync, and it's hit your pleasure center, and it's like, woo. And I have to admit, you know, when I first started out, did I like the taste of that first drink? Absolutely not. But then that feeling came over you, and it was like, oh.
That's what most people say.
You know,
it tastes disgusting. It really does.
But then it does. And then you're kind of like, oh my God, I can say anything. And you feel this invincible, like, you know what? I could give two shits about you. I'm going to tell you really what I think of you. And you know, you're the life
to
of
wake
the party.
up in the morning to look at your phone and be, oh my God, who did I text?
Exactly. Exactly. And then, the next morning, then the collateral damage starts happening.
Exactly.
But, you know, none of us go out with that intention that, you know, we're going to deliberately hurt our family members. I mean, and that's, and so often you hear people that are like, you know what, they just got what it's coming to them. You know, even though, you know, addiction and alcoholism and all that, they are labeled as diseases. And I've said this before many times. I'm not going to get a casserole at my front door. You know, because it's going to be, it's your fault. You did this.
Right.
You know, and I am also a firm believer that, you know what, I'm not responsible for my disease. However, I take ownership, and I need to be responsible for my recovery. And recovery is possible. It takes a lot of hard work, but it is very possible. And I don't make any excuses for what I did. I own that. But when you are working with these people and you are coming in, the empathy needs to be there.
And just not having judgment and not judging them and actually trying to help them. And, you know, reaching out. And sometimes, nope, I'm good. I want to go. I'm done. And okay, well, I'm here if you need me. You can always come back. And that's what I tell them. You can always come back. I'm always here. So.
And thank God for somebody like you that, you know, and I think what makes you even more special is not only are you in the front lines every day, but like I said earlier, you are seeing this patient and they are first and foremost human. You know, and, you know, and I've heard this so many times and it bothers me and I don't like to hear it, but it's like, okay, yep, there's our repeater. You know what? They're human. They're human. And one day, you know what? I don't care who you are. We are all addicted to something.
Exactly.
Whether it's alcohol, whether it's drugs, sex, gambling, doesn't matter. We all have an addiction of one sort or another. But you know what? To hear those people, you know, yep, there's our repeater. You know what? They're human. They're a human being first. And you know what? And to you being that special person, to be that hopeful face, you know, bringing in people that are peer specialists that have done it. They understand. And it does. I mean, it truly bothers me because you know what? It's like, I'm so happy that when I went into the system, there was empathy there. You know, and that's what that person wants. And you know what? I am also a firm believer too that, you know what? You may fall 99 times, but on that 100th time, it may click. So I truly believe that there is always hope. And where there's hope, recovery is possible.
And people can build great lives with recovery. And, you know, as bad as things may have gotten, you know, and this is what I tell people all the time, and my son, my patients, you know, myself, that no matter, you know, how bad things have gotten, once you get sober and you get into recovery, it's going to be so much better. It just, and you can be whatever you want to be. And you can have a great life with that. I mean, just because you had, and it doesn't matter how old you are. You know, I don't care if you're 60, you still, you know, you can accomplish so much and you still have so much to live for and so much to give and, you know, and I think people need to see that too, that you can get sober. I if I look at myself, I mean, where I have been, and everything I've accomplished and I've worked for, and, and I always keep working on things, and you just have to always keep working on yourself. But you can have a great life.
So let me ask you, what do you do for yourself to just kind of decombust from all that? Because I know it can be very heavy. You were in a heavy setting. Like I said, you were seeing the worst of the worst when they come in, and they're literally at their worst, or they're at death's dying door, and you're trying to save them. What do you do for you?
For me, I spend a lot of times with my dogs. We walk a lot. We go a lot of parks and stuff. But for self-care, I practice Kundalini yoga. I meditate. I paint. Those are my main things. I try to work out. I try to eat pretty well. I try to take care of myself. I try to take care of my and if I feel, and I can feel when I'm starting to, things are starting to affect me, and I sometimes I'll reach out to a friend or somebody and just like, things aren't good, and maybe I need or even my supervisor, I could use a break from that, you go somewhere else for a day or something, a few days or something, different service, and that can be really helpful. So I'm pretty in tune with myself and how I'm feeling, and I can kind of tell when I'm like, it's getting to be too much.
Yeah, and that's amazing that you recognize that about yourself. So many of us were geared to just, got to plow right through it.
Yeah,
and it's really hard to not take some of that emotion home. Because I know that, with some jobs like that, they tell you, you should keep work at work. But for you, you literally are in the trenches. You're getting those late night calls. Where, hey, I need you to see this patient.
Right.
I truly believe that self-care is huge. And if you can recognize it, and not only that, even for myself, I know I have to do self-care, and I want to keep going, but eventually I'm going to crash.
Right.
And I'm not doing my program any good, because that's when we start getting in our head. And I know for me that I have to stay vigilant to my program. And and what a blessing you are, because you're paying it forward every day. I mean, you are the greatest example of recovery in action.
Thanks.
You are paying it forward and doing all you can.
You also make a really good point of always work, your program, and always staying with your program. And you had mentioned earlier that people can have different programs, but it's what keeps you, your program, what keeps you in that good spot, that you continue to take care of yourself. So like I would, I would say that I do have a program that, I have my meditations. I belong to a group online where we do meditations, and we read books every week on self-help and self-improvement, and it can be anything from, I think right now we're doing a book called Judgment Detox, which is by Gabrielle Bernstein, but we just did a book called Eat the Frog, which is about, procrastination and how to better, make things work in your life. So we do, so I'm part of this group. So I'm part of groups that, are always improving something, and we have a lot of support, and so that's kind of my program of those things that I'm involved with. That's
amazing, because I'm a huge reader too, and I love to write. Writing was my start, but there's so many good informative books out there, and like I said, I watch a lot of YouTube, especially I love Dr. Gabor Mate. I just love him, and I even enjoy Russell Brand. Didn't care so much for him as an actor, but I love what he's doing, and I think that's really important, for that self-care, and you're encompassing, the meditation, and I've never been able to really get on board with that. It's just not me.
It takes practice.
Yeah,
it does.
It does.
Yeah,
it really does. I have a really good friend that is way into yoga.
Yes, and I'm part of a friend of mine, Jackie Brown. She's a Kundalini yoga instructor, teacher. So I'm very connected with her And we've been doing she's been doing a lot of online things this past year. She's gotten very creative. We're just finishing up a 40-day challenge, and now we're going to start another one, which in Kundalini Yoga is the yoga of awakening. It's a little bit different than other forms of yoga, but a lot of meditation, a lot of different things, different movements and things that we do in a meditative state. So
Great.
So that's been
That's
so I'm very very involved with her and that practice, and that's been very very good for me.
wonderful.
Yeah.
Yeah, you need that. So one last question I have for you.
Mhm.
If you could change anything about the system that you're working in right now, what would you add or what would you take away to make it successful for not only your practicing, but for the actual patient that enters into that ED, the emergency department?
I really feel strongly that we need a better detox center. I think even if it's part of the hospitals, because we have a couple hospitals here, but we are opening there is going to be a crisis center opening in Olmsted County. I know things have been a little bit delayed because of COVID, but they did start building it. It's going to be out by OMC, and that's going to be a mental health crisis center. I think they're planning to have some crisis beds. They're going to have providers there that people can, start medications and things like that. So I think that will be a good thing, a good place for mental health. But I think we need to do something more with addiction. I think detox. We need a better detox center.
Perfect.
I think that would be really important.
So where do you see yourself 5 years from now? Do you see yourself maybe moving on out of the hospital setting and into more of a, to teach this, to pass it on to other new up and coming people that want to learn how to deal?
Yeah, it's hard to say. I'm not sure. I feel really connected to, to chemical dependency treatment and addiction.
Because I know you have a very vast work history, very prestigious of where you've built yourself up from.
Yeah, I've worked in the jail system as well, so that I'm pretty intrigued by that as well. A lot of addiction problems in the jails.
Oh, huge.
So I think that could be changed too. There are some counties, states, other areas that have incorporated medication assistance, withdrawal and treatment for opioid problems, and I think that would be a huge thing to incorporate more in our community, because there's nowhere here to go to detox even from heroin medically assisted. So that's this is a big town.
It is.
We should have that.
We should have that.
Yeah, we should have that.
Really should have that.
So that would be important to me, and I don't know, maybe I get involved in something like that. That would be
Sweet.
kind of cool. So down the line, yeah.
That is awesome.
Yeah, so.
Oh my goodness, wow. We have covered a lot of topics in a short period of time.
Yeah.
And I thank you so much for the service that you do, because really, I mean, we need more people like you. Once again, I can't stress that human component. We are human. Mm-hmm. And we bleed just like everybody else. Mm-hmm. And we have the capability to be great people. We've made some horrible decisions. We've made some horrible choices, but we all can come back from that. Yeah. And we all can be productive members of society. We can be, we can be great sisters, great aunts, great anything. Mm-hmm. I always say the world is our oyster. Yeah. We just need to believe in ourselves, and it really helps to have somebody like you when that person first comes in, that light of hope is there. So I thank you so much for what you do in this community. It's huge. And I really don't feel that a lot of the medical professions, people that do help, they don't get a lot of credit. And that's why I wanted to talk to somebody like you. You see what happens. And, you are that glimmer of hope between somebody living and somebody dying. So I thank you so much for taking the time to be here with me and putting up with my nervousness.
I'm so glad to have this opportunity and to talk about all this, because it really is important, and we want to make a difference and help everyone we can.
Thank you so much, Vickie.
Yeah.
I can't tell you what an honor it was to have you here today.
Thank you.
Thank you.